My social justice issue was socioeconomic inequality in relation to mortality. What is socioeconomic inequality? This is a very general definition that goes across a lot of websites. This one in particular is from Sustainability Directory, refers to the unequal and unfair allocation of wealth, opportunities, and resources within a community. Within the U.S., this imbalance creates a disadvantage for those within a wide range of traditionally marginalized groups or demographics, including people of color, lower income families, veterans, LGBTQ plus communities are affected. Everybody is affected by this issue because it affects so many people individually, but also such a socioeconomic gap of inequality over time can actually slow the growth in terms of development or quality of life for an entire country, from an Inman report from 2014. What is socioeconomic inequality? Who does it affect? Why is it a social justice issue? This issue affects a large majority of the population negatively. It actually affects everybody, but a large majority is negatively affected. There's an unfair distribution of wealth, such as the 1% hoarding all the wealth. There's the 1%, there's also the 5%, there's also the 10%. There's a 15%. There's the large amount of people who are at a disadvantage. A small amount of people are at a great advantage. So wealthy people simply have time. There's an imbalance of income. There's an imbalance of power. They do have a lot of time. Wealthy people have more time and money to dedicate towards issues that affect securing or preserving their wealth. On a smaller scale, wealthier people simply have access to resources, including basic human needs, healthcare. Their needs are met and they're able to thrive. Historic and present day concerns. It's difficult to provide research based on studies in regards to income in relation to quality of life. Just because someone has more money doesn't mean they're necessarily happier. This is hard to get data on because we're taking a concept, we're kind of analyzing a concept that takes qualitative data and we're trying to translate it into quantitative data. So we're trying to see a series of issues and effects and kind of put numbers to it, bring it into the real world, into the reality, get like a pulse on the statistics of communities, at-risk communities, thriving communities. We just need more data around, more surveys, more research around socioeconomic status and in relation to mortality. So why haven't we been able to get forward motion with that particularly? There is two hypotheses, the constancy hypothesis. There's also the divergence convergence hypothesis. So we'll look over those. Basically, in Mesopotamian times, around 4000 BCE, we were recording history for a fraction of mankind's existence. We only recently have tools and tech that allows us to properly record and track deaths and births in a population or society. Neighboring countries have gone forth with gathering statistics and surveys, like UK, like France, like Switzerland, like Germany, in the last half of the 19th century, to collect mortality rates for the concern of health issues in relation to the industrial period. It was first theorized, so that was in the last half of the 19th century, in relation to the industrial period and deaths around the industrial period. But when we look at the monarch era, this is a period in history where medical professionals were worried that rich people were dying sooner than young, poor people. So being worried about the rich dying, it was disproven that they were a risk of dying. Rich people were dying in the monarch area because of idleness, indulgence, moral laxity, meaning it was their way of life that was killing them. The rich were dying because of the ways they lived their life, which was overindulgence, lack of morals. But that's when they started trying to get a number to getting a death rate, getting a death and dying rate in a community. So the two hypotheses that we're sitting at currently is the constancy hypothesis, which is scholars arguing that class differences in mortality have always existed and have not declined but stayed more or less constant. It's stated in this article by John Cassell, mentioned general susceptibility, or a general factor common to many diseases, which means there is equal risk in disease, but citizens of those classes run the same risk of getting the disease. This theory also states a variety of causes in each class also make it difficult to draw conclusions, such as factors including lifestyle choices or genetics or politics and economic factors. Modern medicine during post-World War II, it's hard to get a mortality rate because the mortality rates are usually being skewed due to mass tragedy. The divergence-convergence hypothesis is the other hypothesis on the basis of studies coming from a variety of places and times in the Western world, almost treated as if they constitute an uninterrupted series of observations relating to one and one at the same time or the same place. There are three different stages that can be identified in long-term pattern class mortality differences. So this article went over fundamental social causes theory, arguing with the study, suggesting that there was a variation over time, meaning that there are events outside of our control that have made it difficult to track socioeconomic status in relation to mortality, especially since countries have been attempting to track mortality through events like World War, the Industrial Revolution. We recently had a global pandemic. There's global events or tragedies that cause data on death and dying to be skewed or obstructed in relation to socioeconomic class. So today, this social justice issue parallels large-scale issues. We can see it in our youth, and that fosters a repetition of such a cycle of despair. So there's difficulties in securing necessities. There's a lack of opportunities in terms of education, in terms of lack of basic education, including reproductive health education, or economically sourced nutritional information. There's difficulties in affordable, secure, safe housing, as well as the inability to afford or access healthcare. These resources, or lack thereof, impede on quality of life and life expectancy in correlation with the lack of affordable health care, lack of affordable housing, inability to secure human needs, also mentioning the SNAP benefits being cut, the government having a obligation to take care of their people in times of distress. There's a higher risk, life-threatening illnesses, as they are at a higher risk of being exposed to dangerous environments at work or at home, having an increased risk of drug abuse or falling into drug-heavy environment. There's daily risks and issues and causes, and then that transforms to generational risks and causes. This leads to short-term and long-term illnesses, and this adds to the cycle of poverty that creates the paradigm of despair, which is generational poverty. Micro aspect, the social work values outline the importance of service and serving others. On the issue of socioeconomic imbalance, we can observe ways to serve directly to people in the community. There is a current food shortage, withdrawal of food shortage programs, meaning like SNAP is being cut across the board. There's a lot of health care that is being cut across the board for people who need it the most. A way that many social workers are approaching this on a micro level is just getting into the shelters and seeing where help is needed. For example, my service learning site is Catholic Charities. I was working side by side with a woman who is higher up, and she is in charge of grant and funding. There was an influx of people who needed a meal that day. So she came down and started serving face to face. So she's serving on a meso level by doing her grant writing for that particular community here in Denver for Catholic Charities. She's overlooking the higher scope. She's taking into account daily the overarching macro issue that is socioeconomic inequality, having food shortages like this, having lack of healthcare, lack of income, all of those things, that overarching humanitarian aspect of those suffering. Enter her meso life, which is communal, and she acts on a micro scale. She acts every day on a micro scale, making those connections daily with people that come into the shelter, serving others as they are also serving us in that moment by just being present, letting me into their home so that I can help them serve. And I think having this mentality is critical on a micro scale to remember the overarching need to participate and be present follows through. Give away your money. Billionaires, give away your money. Billie Eilish said it first, telling billionaires like Mark Zuckerberg, give away your money. It's disgusting. It's inappropriate to have that much money knowing that people are suffering. And there's a psychology behind it, but give away your money. Meso, helping families or communal hubs in a food shortage, like I was just talking about with the social worker that I was working side by side with. Working on a meso level stance as a social worker, you could take on issues of socioeconomic inequality by looking at government involvement, looking at U.S.'s history of providing resources, such as financial needs or needs-based assistance to the public. In times of countrywide distress, this is an obligation of the U.S. If not, we're looking at others having to come together in these small communities, which I think we're going to have to do no matter what. I think we need to have this mentality of coming together and overcoming rather than looking at one leader to save us all. I don't think that's going to get us anywhere. And I think coming together in communities with like minds, with people surrounded by your community who are willing to even listen to any kind of accommodation or middle ground, that could probably be our answer. Just coming together as a community and being there for each other. Macro, yes. So tax the rich. According to Chapter 2, the history of social welfare, the obligation that the government has to provide for its citizens, these were issues that we were reflecting on when large issues started impeding the U.S., impeding their development. We're such a young country that these issues, of course, they affected us. Of course, as a new country, post-World War, the Great Depression, all of these things affected every single household. So the government made it a priority to take care of those the best they can. We had to approach situations that affect citizens of a society in terms of income and services. So in researching the study of socioeconomic imbalance in relation to quality of life, it is a macro concept that we have to approach. We have to approach this with mass policy change in terms of benefiting those with less, that help us to correct the imbalance of wealth and resources. That's from a Segel. That's from our chapter 2 from our reading from our textbook by Segel. In macro terms, we can also look at evidence of exactly how defiant the issue of socioeconomic imbalance is in America. The OECD published an article in June 2014 stating the U.S., the average income of the richest 10% is 16 times as large as for the poorest 10%. We also have passed a series of practices and policies that benefit the rich above lower income citizens, referring to top federal marginal tax rates. This is pulled from a video. I honestly hope anybody who is listening could go watch this video. It's about the wealth gap. It's just a clip from Last Week Tonight with John Oliver. It's from 2014. I saw the episode when it aired in 2014. I think of it every single day. I still think of it because it goes over these statistics. It mentions the ordinary income sitting at 70 and the capital gains is at 39.9 back in 78. Then we look at 2009 and it is the income is lowered to 35 and the capital gains has lowered significantly, well below half. It's not 39.9, it's 15. So the macro level aspect would be policy change and reform predominantly and fairly, obviously, taxing the rich through policy change. And lastly, according to Investopedia, which provided basic and accessible knowledge compared to other websites, stating federal estate tax applies only to estates exceeding 13.99 million per person. So about 28 million for a married couple with proper planning. There's 5 states that still collect a true inheritance tax. This basically says if you inherit 14 million, you don't have to pay taxes on it. And then if your partner also inherits 14 million, you are now a household with about 28 million. You do not owe taxes. There's also the estate tax that goes into this, where you don't owe taxes on estates that you inherit. These people, if someone has $14 million and they get to keep all of it, we're looking at the pattern we're in, the pattern we find ourselves in. If they were taxed, that could go towards government feeding and housing programs that could fund basic healthcare in the U.S. You can go, it's money that can go towards public resources like city parks, like libraries, like schools. There's so much that we can get from that. But that policy, that estate tax policy, is very old and inconceivable. That is why old money stays old money. Rich people stay rich because you do not, if you inherit 14 million, you do not have to pay taxes on it. That with the estate tax is inappropriate. So what is the solution? I guess more data and research around socioeconomic status in relation to mortality. We have the tech. We can adequately document deaths, and we could do so over long periods of time in certain populations. This can be an actual study. It would need to be funded. The people are not gonna be able to fund that, obviously. We would need larger funding, probably from the state or from the country, to just gather more statistics on specific demographic, specific areas who are suffering. Is just suggestion, just having more data in terms of socioeconomic status and in relation to mortality. So those are 2 sets of statistics: socioeconomic status, mortality. Those 2 together should be investigated more. We have the technology. We can do it now. And then actively voting for candidates who understand the socioeconomic imbalance and make measure towards resolving that kind of issue. That's very difficult because people with that mentality of wanting to tax the rich, blah, 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 and the people who vote just hear a lot of, raise taxes. They have like a mentality like, what if I get rich, then I'll have to pay taxes. Like, I think having to find a candidate who is able to carry themselves in a way where they have the values and their values are in line with the citizens they want to serve, which is that large population of those suffering because of the imbalance. It's difficult, but I think finding a candidate who would actually spearhead that kind of issue would be godsend. Possible solutions: tax the rich. Okay, before I finish, this is very long. The 1% made 19.23% of the country's income. This percentage rising, and this has been defined since the 1920s, which is when they had those policies that would preserve wealthy people's assets. And that has been there since the 1920s. That clause that says they don't have to pay taxes, that was there on purpose so that rich people can continue to be rich. If you have 14 million, if you inherit 14 million, you don't have to pay taxes. If you inherit an estate, 14 million, don't have to pay taxes. There's a lot of, that's just one example of like the kind of legality, the policies that they arrange for those who benefit the most, which is a small percentage of people. An example of how policies like taxation are sometimes drawn to benefit the wealthy would be the federal estate tax. That's the big one. This is the tax one pays on wealth they inherit and limits taxes paid by the person in possession of the estate. This alone saves billionaires so much money while also keeping wealth in the family, causing a small amount of people to have a majority of the wealth. According to the Center of Budget and Policy Priorities, the article Myths and Realities About the Estate Tax says 99.86% of estates owe no estate taxes at all. That's from 2007, and I looked, and that is still correct. Very sad. So we have the estate tax, and we have the federal estate tax. And we have that 14 million clause, and it's just very disgusting. Learn more, take action. There's a voter app that you can use that gets your location. There's a questionnaire, kind of gathers your political opinion, and then it directs you to the district you are in. It directs you where you vote, which candidates might have your values aligned, who might have values that align with yours. Another source, I was going to put Rowdy's Corner, is a food pantry for MSU students. It's actually taking a hit right now. So if there's a shelter or food pantry you are a part of, possibly maybe for a service learning credit for social work like I am in, you could voice, hey, Rowdy's Corner is in need of some donations. If there's extra here, maybe we can bring it there. This is part of allocating resources. This is part of having like that micro mind, macro mentality, working in a community, and seeing that my peers could be starving or in need because they're trying to get their degree. That is already so much stress, having to work. Many MSU students have to work. We are not at University of Denver. Those students are also probably going through some food insecurity. A lot of MSU students, there's a lot of online access and a lot of leniency for our awesome school, which is so awesome, Metropolitan State. I love being here. It is the less expensive school. Our students need to be taken care of more. I think Rowdy's Corner was good, but if you hear something in regards to someone at our school, in our class, that are suffering from food insecurity, you could email me and I will find you a meal. I'll find you groceries. I will post my personal email too. If you need help, please reach out to me. I would love to help you or find resources for you. I do have resources. I am able to help get food, so please reach out. You can email me, chloemendez96@gmail.com, whenever. And thank you so much for listening if you got this far. Sorry this is so long. But yeah, thank you so much. Here are my references.